What's going on, everyone? Welcome to the Wednesday edition of the Pandemic Update for Wednesday, August 16th, 2023. Hopefully everyone's doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. And if you did test positive, I hope you have a full and speedy recovery with no long COVID issues. Alrighty, we're going to start off on a different path today. Normally would show some news, and yes, this definitely qualifies as news, but after this we'll show you another news story. But you've heard me made mention when we do the variant proportion in our updates here that there is this new mystery variant going around. Well, we got a little bit more answers, plus some reason for concern. Some people that are not usually, COVID, trying to prevent COVID, well, they do, but they minimize ones that don't usually tell you to wear a mask or anything like that. All suddenly they're starting to maybe we ought to take interest here. So look down here. I put a tweet this morning, or an X post. It's called X now. It'll always be Twitter to me. Seeing some of the minimizers get worried is a bad thing. I suspect we're heading into a bigger danger zone soon. Be safe. And that's true. The ones that have stopped telling you to wear a mask, the ones that are saying, don't worry about every variant, and then all suddenly they say, whoa, this variant looks interesting. That's when I start paying attention. And Eric Topol, he's one of them. Sometimes he's like, okay, you got to take this seriously. Other times he's like, you can go out and do your business now. And I don't know why that is, but in this case, he's like, whoa, we need to stop for a second. So Eric Topol put on August 14th, keep an eye on this SARS-CoV-2 variant that has popped up in Israel and Denmark with 30 mutations in the spike protein. Then we come down to this. A Stephen W. Thrasher tweeted this yesterday. PSA, just arrived at JFK, masked, and masked CDC staff are right outside of customs, offering free at-home test, and they're only asked to do a totally anonymous swab here and say you are coming to trace variants, but not trace you. Interesting model. So, what's going on here? Eric Topol just tweeted that there's a new variant that popped up in Israel, Denmark, with 30 mutations in the spike protein. And now all suddenly, CDC wants to do random testing at the JFK airport, which is one of the busiest airports in the country. What's going on? Why is the CDC all suddenly concerned that we're not doing enough sequencing? What's that about? All right, let's move on to this, and this has to do with it as well. Scientists call for Brits to wear masks again due to startling new COVID variants. Now, you might have heard me just go like, what? That's like, I'm not against it, but I'm like, whoa, this is a red flag. All of a sudden they're saying you should wear a mask? Okay, something's clearly up here. It says here, scientists have called for people to start wearing face masks again amid a worrying COVID-19 variant mutation. And it starts off to tell you, the warning comes as the latest data showed that Eris, a subvariant of Omicron, now accounts for 1 in 10 COVID cases, while the number of people recorded with the virus jumped from an estimated 3.3 to 100,000 to 7.2 in the space of less than a month. Well, let's come down here. It says, but a brand new substrain which has not yet been formally named, which the WHO's not going to name it. The people who are naming it right now is just random, scientists, virologists, or epidemiologists, people like that. They're the ones who have been putting these names. The WHO did name Omicron, but these other names like Eris, that wasn't by the WHO. Anyhow, has not yet been formally named, but is referred to as BA.6. So remember when we had BA.1, BA.2. I think there was a 3, 4, there was a 5. Well, now we have a BA.6. So we'll have to see what more comes out of this, but it's relatively interesting that now there is a BA.6, and it is quickly starting to show its ugly face in the UK. Is that what the CDC is looking for up at JFK Airport? I don't know. We likely won't see this in the data for the new update on Friday. If we do, I'd be shocked. case you're wondering what I mean, is the CDC will update the COVID variants on Friday. They update it every other week. Maybe it'll go back to weekly with this concerning one. I don't know. But it's something we have to watch in the coming week's data. Then we come to this story, which I was just alerted about right before, as I was about to start doing my recording. I saw a friend on Facebook post about it. I saw some people have sent me messages on X, Twitter. Bruce Springsteen, he's ill once again. And this is apparently pretty serious. He was supposed to have 2 shows. One was to be tonight here in Philadelphia, another on Friday, August 18th. Both shows have been postponed for the time being. And I thought this would be a good chance to remind everyone something. See, I'm going to lead up to something. Let's backtrack back to April. Let's go over to my website over here. Datareport.info. Bruce Springsteen, yes, he's in the COVID positive archive. He has had COVID. His wife has had COVID. Bruce Springsteen and his wife Patty have tested positive for COVID. It looks like they tested positive sometime just before April 15th. Bruce is currently 73 years old, and his wife Patty is 69. At the time, they are said to be doing fairly well so far. That may be. Maybe they did have a mild case. However, those who even had just a mild case sometimes have a new issue after their case. As you know, sometimes it's long COVID. Sometimes it is this. Now, we have an archive on my website, which is COVID studies and papers. And within that, you'll find a few postings about the immune system. I think eventually I'm going to add a section, a category within the archive that's going to be COVID's effect on the immune system. I think it's needed, because this is a great example of it right here. So let's look at 1 and 2. Long COVID. Long COVID seems to make distinct changes to the immune system. Let's go down to number 2. Immune systems seriously weakened by COVID. Then we come over to this one that I just found a little bit ago. COVID-19 studies suggest long-term damage to immune system. So here's the deal. If you had COVID and it damages your immune system, let's just say, for example, put yourself in Bruce Springsteen's shoes. Perhaps he had immune damage. Well, Bruce Springsteen does a lot of concerts. He meets a lot of different people. He plays with a lot of different people. There's thousands of people at his concert. If someone with a weakened immune system, a damaged immune system, is in large gatherings, there's a higher chance you're going to come in contact with someone that has a virus, a bug, a cold, a flu, COVID, some sort of illness. Well, guess what? With a weakened immune system, you can catch those bugs much easier, and the immune system's not going to be able to fight them off as easily. So, hence here, Bruce Springsteen had COVID. Now, already, that was just back in April. Here we are in August. Already, he is sick yet again. So, we can suspect perhaps Bruce's immune system is now weakened. Alrighty, moving on to today's air quality. We do have some concerns here. We've got a couple concerns. One, which is a smaller concern, across Michigan, Ohio Valley, we do have some slightly elevated levels of bad air quality, and that even extends into western New York. It's starting to get bad there as well. You can see there is definitely some oranges. Comes from Canada. But then we come up here to the Pacific Northwest and even California. Along the coast in Washington, Oregon, fine. In the mountainous region, look at this. You're seeing some maroons, 200s. I'm seeing some 300s. Wildfire smoke, once again, is an issue. If you want to see more about climate and how it affects our lives and weather, I got a channel just for that. Climate data report down below. I'm hoping we will get a climate update out today. I was supposed to do one yesterday. Didn't get around to doing it. Hopefully we'll get something out there. Even if it's just a short 5-minute one, we're going to get something on there today. All right, taking a look at Walgreens. We know that Walgreens COVID positivity for this week did update, and it dropped a little bit. It was 43.4%. Prior week was 44.2%. That's a difference of down 0.7%. Total tests, 3,140. The prior week was 2,889. Any of these states in the red are rising. Any of the states in the green are drop. Now let's take a look at the BioBot wastewater for this week so far. As we can see here in the Midwest, it continues to be up. That's the fastest right. It's really rising there. Slight drop in the south, slight drop in the northeast, but the West Coast is rising at this time. We'll get another update on this later in the week. Not going to do any of those scan wastewater sites for today. We'll just briefly take a look at the CDC site. You can see orange and red sites. That's moderate to high. They continue to rise at this point. As we know, hospital admissions the past week, yep, they continue to be up 10,320. A lot of orange on here, which is moderate to substantial hospital increases. We're skipping over this day in pandemic history today because we do have some other things to show you. EG 0.5, it's 17.3%. Then FL 1.5.1 is 8.6%. There are some other variants in between, but the two I just mentioned are ones that are most concerning to us. Taking a look at New Jersey today. Whole lot of nothing. It's the exact same number as yesterday. And it's even showing up here on the chart. They just have, maybe it's the same number today, I don't know. But it is 343 today versus yesterday, which was also 343. In the ICU, we have 28 people in the ICU. And on a ventilator, let's move myself over to the right here. On a ventilator, we do have 10 people on a ventilator at this time. All right, crossing the river into Pennsylvania. Daily totals for August 15th. This was yesterday's total EMS totals is what we are concerned about here. There were 863 EMS incidents in Philadelphia yesterday. That, my friends, is relatively concerning. That's a really high number. I get concerned when it gets to 800. We've now crossed over 850 in a day, so that's not good. Yet I read last night, just last week, only one COVID admission in Philadelphia last week. So you mean to tell me that call volume's going up for EMS, but just one COVID admission? They're not testing enough in the hospitals for COVID. They're just not. They're not testing all patients. We have CHOP here, which is Children's Hospital of Philadelphia. I've had people tell me they're just designating it as colds or mystery colds. They're not testing for COVID right now, so this is not good. Let's take a look at active EMS incidents here. I did see a lot of ambulances this morning. I looked a little bit ago. It wasn't too busy. A little bit busier now. It was below 10 a few minutes ago. 11 incidents in Montgomery County right now. Let's take a look here in Chester County, Pennsylvania. Whoa, what's going on here in Chester County? A lot of incidents. I see multiple ones that say heart problems, so that's not good. We see injured person. We see a whole bunch of different stuff going on here. Some of that could be because of car accidents. And Maryland, yet another busy day for you when it comes to the hospital situation. Look at this. We have very busy hospitals. I can show you other regions where it is the same. Yes, a lot of yellow and red alerts. And now we come over to this, New York State. 1,078 new cases in the last 24 hours, not including reinfections or at-home tests. The positivity was 12.7%. The 7-day average is 13.3%. So the daily positivity is lower than the 7-day average. Then we come over here to this hospitalizations. 947 people in the hospital, 85 people in the ICU. We don't like seeing that ICU number continue to rise, and it actually dropped a little bit today, so I will give you that. Let's take a look at New York City. I think it might have been New York City that I saw rose for the ICU number today. No, it did not. Maybe it was Long Island. The point is they are up from where they were a month ago. Here's the number of people in the hospital. Wait a second, that's not New York City. Of course, it refreshed on us. This is New York City. 428 people in the hospital in New York City, still higher than any point last week. That is 38 people in the ICU. And let's see here. They only had 38 people in the ICU last week one time. So, yes, that's still a concerning number as well. And let's just take a look at Long Island as well real quickly. And you can see Long Island, yes, Long Island. Number of people in the ICU did go up. Number of people in the hospital did go up. So not a good trend to see. And now we come over to Colorado. As of the time of this recording, or at least before I started this, I did not see an update. Hopefully they have updated now. And nope, still not seeing an update for Colorado as of yet. Last week they reported 952 cases. I think they're supposed to update today, so we'll see what happens in tomorrow's report, hopefully. And California, we'll get that tomorrow we did unfortunately get Texas today, and I say unfortunately because well, it's good that they're updating. The numbers are not good. Change from previous week. 2,830 new cases, more than the previous week. 14,632. Previous week was 11,802. That's a pretty big increase. And then we come down here to deaths. They had 21 versus 13. That's 8 higher. Their deaths are increasing too. We don't like seeing that. Hospitalizations, 992 versus 860. That's 132 higher. 7-day average is higher. So everything is going up in Texas, and cases, they're going up fairly quickly. And I know some are going to say, well, back in 2020 or in 2021, they had X amount of cases. I get that. They had a lot of cases back then in one day, but you have to remember, this is during a time where people do not test as much. So this is relatively concerning to see 14,632 new cases, and it's concerning to see the rise in hospitalizations. Briefly taking a look at an international update here today. We don't have much to show you at this time. I do want to click on Europe today, and let's do that. Let's just click on Europe, and you can see here several countries there at this time. Belgium, 68% higher. Switzerland, 62% higher. Bulgaria, 10% higher. Norway, 36% higher. Denmark, 59% higher. Keep that in mind. Denmark's one of the countries that's potentially seeing that BA.6, and this is what we want to see. Now, for some reason, it's not updating the UK. Okay, I thought I could show you the UK on here, but I guess not. Poland, cases are now 75% higher, so that is not good to see. And taking a look here at deaths on the right, yes, there are places that have a rise in deaths. Norway has 250% rise in deaths as well. And Denmark, deaths have doubled. They went from 3 last week to 6 on the latest 7-day update. So not good that we're seeing cases and even hospitalizations, deaths rise around the world. Obviously, hospitalizations will be rising as well. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update again tomorrow. If you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. If you know anyone that needs a wake-up call, or maybe they would like to know that COVID destroys the immunity, and maybe they're like, nah, that can't be right, send them my way. As you know, we got a couple articles and stories that have been shared or that you can find on my website. And as you know, we talked about it here earlier today. So, share this with them. This is very important information. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a great day.